This is Kimmy Mondaire doing a biopsychosocial assessment on pediatric 6-year-old female. Hello, welcome to the office. My name is Kimmy. I'll be the nurse practitioner doing the biopsychosocial assessment on your daughter today.
Awesome. Nice to meet you. Can you say hi?
Hi. Hi, sweetie. What's your name?
Hazel.
Hazel. That's a pretty name. How old are you now, Hazel? 6. Okay. How are you feeling today?
Good.
Good. You look a little bit nervous. I'm going to just go over a couple things that we're going to do today, okay? I'm going to ask you and your mom a couple questions, and then I'm just going to listen to different parts of your body, okay? But your mom will be here the whole time, okay? I'm going to be using a couple tools, okay? So I'm going to show you some of the tools I'm using, but they're mostly just lights that I can look into your eyes, your ears, and your mouth. And then I'm going to be using something called a stethoscope. And this goes in my ears, and I can listen to your heart and your lungs and your stomach with this part. Do you want to try it? Here, you can play with it. I also have a little stuffy here. If you want to try listening to him?
Go ahead.
Okay. So while she's doing that, I just have a couple questions about her history. Looks like all of her, the nurse has already done her vital signs. They look normal for a 6-year-old. They did her height and her weight. She's in a normal height and weight BMI according to her growth curve. So that's all good. It looks like she's up to date with her vaccinations of her MMR, Tdap, and her chickenpox. Has she gotten the flu vaccine this year?
No, not yet.
Okay. If you're interested, we can administer that today.
Awesome. Thank you.
And we also do offer the COVID vaccine and information about that, but it is up to you whether you want to give that, and we could give you more information if you're interested.
Thank you.
I'll also provide you with her vaccination record for her school.
Awesome. That's perfect.
Okay. Do you have any concerns before we get started, behavior or medical wise?
We struggle a little bit with listening, but something we're working on. So not really concerned, but something that I have on my radar.
Okay. And what exactly do you mean by that? Can you give me an example?
So she started kindergarten this year, and I know she is struggling with listening comprehension from an academic standpoint.
Okay.
And then at home, following directions and listening has always kind of been a pain point.
Okay.
So we are now working on our listening skills, to build up that skill set.
Okay, all right. As a 6-year-old, we'll try to figure out what parts are normal age development and which parts might be a little bit more concerning, and perhaps give you some information on where you can go further if there's further testing that's required.
Awesome. Good job.
So, has she been hospitalized or had gotten any kind of urgent or emergent care since your last visit?
No, not at all.
Okay. Has she been sick lately?
We did have a 24-hour stomach bug at the beginning of the year.
Okay. How was that?
She actually did pretty good. We didn't have anything come up, but she just did not feel too hot for about 24 hours. Her appetite was really limited, but she did sleep a lot, but it went through the whole house, so I could tell that's what she had.
Has there been any changes in her environment, people coming in and out of the house that are new, staying here, or a family member that could be leaving the house, or anything changing in her environment?
Nothing as of recently, only the fact that she started kindergarten.
Okay. Alrighty. Have you noticed anything abnormal when she started kindergarten as far as, other than the listening, but has she been a little bit more reserved? Is she appearing anxious or any changes in that aspect?
I think she's just a little frustrated because she does get bored at school, even though academically the teacher's super excited as to where she stands.
Okay.
But she's basically bored and wants to always be playing. So,
okay. But
that definitely, we've seen her be able to settle in after the holidays kind of came through. I have seen great improvement from when she started in September.
Okay. That's good to know. All right, Hazel. I'm going to talk to you for a little bit, okay? How's your stuffy doing? Did you listen to him? Yeah, he's doing okay? Alrighty. So while I'm doing this assessment, I will be referring to the camera a few times just to make sure I'm able to be clear with what I'm assessing.
Perfect.
So just on a quick physical inspection, Hazel appears to be well nourished. I don't see any gross or abnormalities in her appearance. Her skin is pink. It's not flushed. It looks like it's vascular. I don't see any abnormalities in the face shape, eyes, or where the ears are sitting on her head. I don't see any obvious deformities in the face or extremities either. Her head does not appear to be large. It's normal. It's sitting appropriately on her neck. I don't see any kind of torticollis as well. She's able to move her head and neck appropriately. Behavior-wise, she does appear to be a little bit shy, but that is probably just in the context of the circumstance that we're in with doing an assessment. Alrighty, I'm gonna start taking a look at your head, okay? I'm gonna be touching your head with my fingers. They're a little bit cold, okay? So I'm just gonna start looking at your hair. She has nice, soft hair, does not appear to be brittle. The hairline is normal. I'm not seeing any alopecia or premature balding. Not noticing any kind of lice or lesions or bruising on the head. I'm gonna come back here. Any tenderness? Does it hurt when I press on your head? Okay, I'm gonna palpate her occiput. Okay. The head and skull appear to be normal. I don't see anything concerning there. I'm gonna take a look at your eyes now, okay? Remember I told you I'm gonna be using some tools? I'm gonna be shining a light in your eyes, okay? And while I do that, I want you to just focus on my nose, okay? Try to focus on my nose and don't move your head, okay? So while I'm doing this, I'll be checking her pupils, her extraocular eye movements, her peripheral vision, but I'm also going to be keeping in mind how she follows commands, if she's able to maintain an attention span, or anything that could be concerning on that level. All right, honey. Just on a quick assessment, her sclera is white. I don't see any burst blood vessels, no jaundice. There's no extra tearing from her lacrimal duct, no drainage. The conjunctiva is nice and pink and moist. So I'm going to start shining this light in your eyes, okay? You just take a look at my nose, okay? All right, dear. So what I'm looking for is the pupillary reaction to be consistent on both eyes. When I shine the light into her eyes, I expect the pupils to constrict or get smaller, and as I pull the light away, I want the pupils to get larger. And I'm going to do that a couple times because I want to make sure that when one eye does it, the other eye does it as well. How was that? Good? Okay, was that too bad? Good. You did such a good job. Okay, so her pupils, because of how dark it is in this room, her pupils are about the size of a 3. They're round, reactive, brisk, equal, and reactive to light and accommodation. All right, now I'm going to have you look at my nose again. I'm going to move my fingers, and I just want you to follow it with just your eyes, okay? Not your head, just your eyes, okay? So just follow my finger. I'm testing the extraocular eye movements. Very good. All right, now I'm going to check your peripheral vision, which is like what you see on the sides, okay? So I'm going to be bringing my hands up, and you just look at my nose, and you tell me when I start wiggling my fingers, okay? Let me know when I'm wiggling my fingers. I'm wiggling my fingers. Very good. Okay. So she is able to follow commands appropriately. She is a little bit shy and reserved, but again, that's probably more related to context. Her level of consciousness is awake and alert and appropriate. I give her a RAS of 0. I don't see any kind of abnormalities in her orientation. Okay, so we're going to move on. I'm going to now take a look at your ears, okay? Have you had any pain in your ears? No. Okay. With her being 6 years old, sometimes ear infections are a little bit more common just with the anatomy of the ear canal. So we do sometimes see spikes, especially around this age with ear infections.
I will say she develops a lot of wax, something that we covered with our pediatrician before.
Okay.
So, and then they did advise us only to clean them once a week and not to go too hard on it.
I'm going to be tugging on your ear a little bit, and I'm going to take a look with my light, okay? And some of the signs of an ear infection would be tugging on, if the child is tugging on the ear a lot, and accompanied with a fever. Alrighty, so if you don't mind, just turn your body towards your mom, and I'm going to take a look at your ear, okay?
Okay.
And I would do this on both ears. I'm going to just move your hair back. She is old enough where I don't have to pull the pinna down. So I'm just going to tug her ear back a little bit. Take a look in the ear canal. Very good. I'm not noticing any redness or any foreign objects in the ear. She does have some earwax or cerumen, but nothing abnormal. The inside of the ear canal is opaque. Around the ear is nice and pink. No lesions around the ear. When we're cleaning the ears, so we want to make sure just to keep it external and not actually poke anything inside of the ear canal that can harm the eardrum.
Mm-hmm.
Very good. Have you? So you did mention things with listening, but are there any issues with hearing?
No,
Or actual physical ability to hear? Okay, good. I am going to do a very quick hearing exam on you. It's called the whisper test. So I'm going to just whisper something in your ear and you tell me what I'm saying, okay? Are you ready? Okay.
Apple.
Apple, that's right. I'm going to do another word in the other ear, okay?
Yes.
Good job. So nothing too concerning there. If she wasn't able to understand the whisper test, we could move on to the Rhine test or the Weber test, but that's not necessary in this case. The concerns that the parent brings up about listening is probably more developmental, but we will move on with that in the psychosocial part of the assessment. Alrighty. Has she been having a runny nose or congestion that you've noticed?
No.
Okay. I'm just going to take a look at your nose now, okay? So I'm going to shine a light into your nose. I'm looking at your boogers, okay? Alrighty. Alright. The nares are they're open. There's not anything obstructing the nasal cavity. They're pink. There's no excessive drainage, nothing purulent that's visible from her nasal canal or nasal passageway. And the patient does not endorse any kind of pain or drainage coming out of the nose that would be concerning for infection. Okay, we're going to move on to your mouth now. Just on a quick inspection, the lips are moist, they're pink. I don't see any lesions or ulcerations or any kind of gross abnormalities or any kind of scars. Alrighty, honey, I'm going to have you open up your mouth real wide for me, okay? Good. Alrighty, so inside of her mouth, I'm looking at the buccal mucosa. It is nice and pink. The hard and soft palate of the roof of her mouth is intact. And the tongue is pink, it's moist, it's not coated. Can you stick out your tongue for me? Move it side to side. Very good. I'm looking all around the tongue to make sure there's no ulcerations or lacerations. Okay. The uvula is midline, and The teeth do look clean. I'm not noticing any cavities on a quick exam. Does she go to a dentist?
Yes.
Okay. Hazel, do you brush your own teeth? And how often do you brush your teeth?
What does that mean?
Like, how many times a day do you brush your teeth?
A lot of time.
A lot of times. Okay. All right. That's very good. So her teeth look very clean. I didn't notice any buildup of excessive tartar. You're already following up with a dentist. We do encourage that at least twice a year, and we encourage brushing and flossing. Using a fluoride toothpaste is best. Just a pea-size amount in the child's favorite flavor works best. And then flossing if they're able to frequently as well, just to prevent cavities. Okay.
Perfect.
I didn't notice anything abnormal in the oral cavity. So we'll move on from there. Her voice and her speech and language are not abnormal. She's a little bit shy. She's a little bit soft spoken, but again, that's all circumstantial. But she is answering questions appropriately. She is mentating throughout the entire assessment so far. Okay, I'm going to take a look at your neck, okay? I'm just going to start feeling around, and I'm just looking for any kind of lumps, okay? Does that hurt? Okay, I'm just feeling for the lymph nodes, just making sure they're not inflamed or enlarged. Does that hurt at all? Okay, good. Okay, very good. I'm going to go down here as well, palpating. Alrighty. I'm going to press under your eyes as well. Any pain here? Okay, very good. Do you wear glasses? No. Okay. Does she have an eye doctor or anything?
She has not been to one yet.
Okay. Again, that's just something you can put on your radar. Mm-hmm. If you've noticed if she's had any trouble in school, if it could be related to her not being able to sometimes see the whiteboard or blackboard or whatever her teacher is using, that could be something that we'd want to check out. But that would probably be more endorsed with like frequent headaches and anxiety that you might see. That could be visual related.
Sounds good.
Okay. All right, hon. Now I'm going to move on with taking a listen to your chest, okay? Remember I told you I'm going to be using my stethoscope? Okay. All right. You can keep holding on to the stuffy, but I'm just going to have you bring your legs down. Okay, very good. Now, does she have asthma or any breathing problems?
Nothing.
Okay, good. Any allergies?
Nothing.
Okay. Alrighty. All right. Take a deep breath for me. Good. Like you're smelling the flowers and then blowing out bubbles. Good job. Do it again for me. Good. Again. Good. Is it relaxing? Good. I'm going to have you lean forward a little bit. I'm just going to listen to the lung fields anterior and posteriorly. Deep breath in and out. Very good. Very good. Okay, you can lean back. Now I'm going to take a listen to the lung, to the heart. Typically, we'd want to listen to respirations and pulses for a full minute. With children, they tend to have abnormal respirations. They sometimes breathe very quickly and then can be apneic or stop breathing for a short period of time, which can be concerning for parents, but it is normal for children to do that, and then they pick right back up. The lungs are clear. I'm not noticing any wheezing or coarseness or rales. Didn't notice any murmurs or gallops by listening to her heart either. Excuse me. Okay. Alrighty, honey. I'm gonna now take. Can I have your hands? Okay. I'm just feeling your pulses here. She's nice and warm. I don't notice any edema. which is just swelling. Very good pulses. I'm going to press on your fingernails. Okay, and I'm just checking the cap refill here. She's perfusing to her extremities well. It's all less than 2 seconds where they're blanchable and the blood is returning. Okay. How's your diet? What do you like to eat? Macaroni and cheese. That's delicious. Do you eat fruits and vegetables? Okay, good. That's always encouraged to incorporate the things that you like and some of the healthy stuff as well into your diet. Do you feed yourself? I'm so sorry.
You're good.
You feed yourself? Good. Okay. Do you dress yourself also? Wow, you're a big girl, very independent. Children of this age do typically like to do everything or as much as they can by themselves. So dressing themselves is a big thing. So picking out their own hair accessories and tying their own shoes, picking out their outfits are a big thing for them. Okay. Alrighty. So now I'm going to take a listen to your belly, okay? Does your belly hurt at all? Okay. Typically the belly would be exposed, but due to her age, I'm not going to be exposing her belly on camera, but I would lift it up and I would assess to make sure there's no gross abnormalities or any obvious organ enlargement. There it is. There's your belly button. Alrighty. I'm going to take a listen. Does she typically have normal bowel movements? Okay. Okay. All right. She's got active bowel sounds. No issues or concerns there. I'm going to start pressing on your belly. You let me know if it hurts, okay? I'm going to go soft. Any pain? Okay. Go a little bit deeper. Any pain? And as I'm palpating, I'm also going to be looking for any kind of liver enlargement or organ megaly, which I don't. Not noticing there. Very good. Do you go to the bathroom by yourself? Okay. Do you clean yourself up? Okay, very good. When you go to the bathroom, when you go pee, does it sometimes hurt when you pee? Ever? Okay, good. And what color is the pee usually?
Yellow.
It's yellow. Okay, that's good. We could discuss signs and symptoms of UTI in this age. I'm not going to be exposing the child for a GU assessment, but I could discuss the normal expectations of what the genitals should be looking like. As a prepubescent, we would not be expecting hair or enlargement of those areas, but that would be something to keep in the back of our mind as she may be transitioning into that stage within the next couple of years. I would also be, while I'm doing my assessment, keeping in the back of the mind for any kind of signs of abuse, which I'm not noticing, but as well as sexual abuse, which I will not be performing on camera. Okay. Alrighty. All right. I'm gonna have you actually come sit up here a little bit closer to me, and I'm gonna check your strength. Okay. I'm gonna see how strong you are. I'm gonna give you my hands, and I want you to squeeze as hard as you can. Wow, that's really strong. Can you pull me towards you? Good. Now push me away. Very good. Can you wiggle out your fingers? Oh, good. All right, go like this, and I'm going to press down. You're going to stop me, okay? You try to stop me, okay? And do it again. Now press down. Press down on my ass. Very good. With all your strength. Very good. Okay, so she's following commands appropriately. She has +5 strength in all of her, or in her upper extremities. It's normal, and bilateral strength is equal. I'm going to put my hands on your shoulders. I want you to shrug your shoulders for me. Very good. And you can bring them back down. Okay. Very good. All right. How do you like school?
Good.
Good. Do you have friends in school? Okay. What's your favorite subject in school?
Do my special.
What is that?
What's your favorite special?
Oh, what's your favorite special? Yeah.
Gym.
You like gym. Yeah. You like playing sports? What's your favorite sport? You like all of them? Okay, yeah. I liked gym class too.
You want to tell Kimmy what you do? Your dance? You want to tell Kimmy that you do dance?
You dance? Oh, that's very cool. What kind of dance do you do?
I do ballet and jazz and lyrical.
Oh, wow. Are you able to show me a dance move? No? Okay. Alrighty, that's okay. So through that little bit of conversation, she's able to hold her attention span. It's normal for her to look towards the adult in the room for confirmation and safety with a stranger in the room. So I'm not concerned about that. I also am noting just a little bit of fidgeting during this assessment, which could just be because it is late at night. But if the parent had concerns for any kind of hyperactivity or attention deficit, then we can get her set up with a specialist. But at this time, I'm not noticing anything very concerning. Okay. She was able to hold an attention span. I'm going to test your memory a little bit, okay? So I'm going to give you 3 words, and then later I'm going to ask you to repeat them to me, okay? Okay. The 3 words are ball, red, dancer. Okay?
Red dancer.
Good. I'm going to ask you about them a little bit later, okay? But can you tell me 5 colors?
Pink, purple,
Mhm.
green,
Mhm.
blue,
Mhm.
and red.
Good. Okay. Very good. So she just named 5 colors. She's able, intellectually functioning appropriately. So you're 6 years old now. How high can you count?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Good job. Wow, that was great. Now, are you able to count backwards at all? Okay. Do you know, can you start from 5 and try to count backwards?
5, 4,
Mm-hmm.
3, 2, 1.
Very good. Good job. Again, she's got a normal thought process. Her intellectual functioning is intact. She's able to count forward and backwards, which is good. Very good. Do you remember those 3 words that I told you to remember? Can you tell them to me?
Ball, house,
Okay.
dance.
Okay. So the patient said ball, house, dance. The 3 words that's very good. The 3 words were actually ball, red, and dancer. Okay, so you were so close. That was very good.
job, baby.
Good job. So that maybe that's something that we can potentially work on, is just maybe some memory games for her. Although this was just a one-time test, if that's potentially something you can look out for. Although I think there are a lot of distractions going on right now, so everything is a little bit circumstantial in this situation. Psychologically, I'm also keeping in mind her mood. She's not hostile. She does appear to be a happy child, just a little bit shy, can be distracted at times, and as a normal 6-year-old, she probably does not want to be in this situation. So she's just trying to be comfortable, but with her stuffed animal, and and playing appropriately. So developmentally, I'm not concerned about anything right now. As far as ADHD, if there are more concerns that the parent brings up, we can discuss that with a specialist, and have her go through some examinations if she needs to try to make sure that she's excelling in school. She appears to have a well-rounded social system. She is well-nourished. I'm not concerned for any kind of abuse. She lives in a home and has 2 supportive parents to take care of her. Her physical assessment was benign as well. At this time, I would not assess suicidal or homicidal ideation, as she's still very young. And I can see that musculoskeletal-wise, there's no gross abnormalities. Hazel, I'm actually going to have you stand up for me real quick. And can you hop on one leg? Good. Can you hop on the other leg? Very good. Very good. Alrighty. Again, she's able to follow commands. She's got good strength bilaterally. I would give her +5 strengths in all of her extremities equally. At this time, do you have any questions or concerns about her assessment?
I have nothing more than that.
Okay, so what we can do is give the flu shot and discuss. Not really. It's just pretend. We'll discuss any other information regarding her attention and how she's doing in school. Typically, teachers are one of the first people that notice these kinds of abnormalities in children, so it would be encouraged to speak with her teachers to see if they notice anything. Hazel's able to make eye contact and answer questions appropriately. Her speech is clear. It's a little bit soft, but no signs of autism spectrum disorder. And I'm not noticing any signs of depression or anxiety for this child. So I will do my write-up. We'll do the flu shot, and I will give you the vaccine records as
Perfect.
we talked about. And we'll see you next year. Okay?
So thank you so much.
You're welcome. Bye.
Bye.